Good morning, friends. Welcome to a new case. It was in 1980 when I was residing in Lajpat Nagar, a posh colony of South Delhi. I was called by somebody in the neighborhood to examine a case. When I saw the case, I found a young man in 30s, male, lying on the bed with a cannula inserted in the peripheral vein on the right wrist. A drop of blood was oozing from the cannula, showing that it is all a recent occurrence. I came to know from the history that patient was admitted in the All India Institute of Medical Sciences, New Delhi. He was given this drip and cannula, but due to reasons best known to him, he ran away from the institute and came out with cannula. I explained to the relations the mistake they have made, but they said that no, doctor, you have to treat it. So with this type of situation, I admitted the patient in a nearby nursing home. I restored the intravenous line and started the treatment. Now, before I talk more about the patient, I must tell you what the patient was suffering from. The patient was suffering from a heart disease, which is called rheumatic heart disease. Friends, what is rheumatic heart disease? Rheumatic heart disease is a disease which affects many systems. For example, it affects the joints, causing arthritis and arthralgias. It affects the nervous system, causing chorea. Chorea is bizarre movements of limbs, purposeless movements by the patient. Then it involves the heart, producing all sides of valvular deformities. It can involve the subcutaneous tissue, producing subcutaneous nodules, and it can involve the skin, producing a lesion, specific lesion called erythema marginatum. In our country, erythema marginatum and subcutaneous nodules are usually uncommon. The most important features of rheumatic fever in our country are arthritis and heart involvement, that is the carditis. In few cases we see chorea also. So on examination, it was established that patient had classical murmurs of valvular involvement. The patient had mitral stenosis, mitral regurgitation, and aortic regurgitation. These are all three valvular abnormalities. What is mitral stenosis? Friends, I have already shown you in the diagram, and today again I am going to show this diagram. I have told you that there are four chambers of the heart. Two are collecting chambers, like this right atrium collects blood from the upper and lower parts of the body. The left atrium is also collecting chamber. This collects blood from the lungs through the pulmonary veins. Then we have a right ventricle, which is a pumping chamber. It receives blood from the right atrium through an opening between the right atrium and right ventricle. You can make it out. From here it is passing like this. See again, from here it is going like this in this. Similarly, on the left side, this you have a pumping chamber, left ventricle. You have been told that walls of left ventricle are very thick. They are much thicker than the right ventricle walls. The left from the left atrium, the blood passes through this opening into the left ventricle. This opening is called mitral valve, and this opening is called atrioventricular valve. It is a tricuspid valve. Now when we say bicuspid, tricuspid, what do we really mean? Bicuspid means there are two curtains to close this valve, and when the curtains close, no blood can move from left ventricle to the left atrium. But when this opens, it opens towards this side. From here it opens downward like this, in this direction, and from here it moves to this direction, so that this opening is pretty big, and blood quickly passes from the left atrium into the left ventricle. This is very important thing. If this becomes narrow, then it will take more pressure to push blood through this opening, and with this increasing pressure, this chamber goes on becoming bigger and bigger, so that ultimately it becomes a giant left atrium. Now you also know from the left ventricle, blood passes into this channel, big channel. This is called aorta. This part is the ascending aorta. From here, behind this artery, this portion, and then it makes an arch like this. This is an arch made here. This is called the arch of the aorta, and then from here the aorta goes behind the heart and comes out here. This is called abdominal aorta or descending aorta. So from the right side, you also know that blood passes through this valve into this artery. This is the pulmonary artery, and from here it gets divided into two. One goes to right lung, the other goes to the left lung. One goes to the left lung, the other goes to the right lung. This is impure blood or deoxygenated blood, which goes for purification to these things. Now see another diagram, just for your understanding, better understanding and better understanding. I use the word here. Now I bring the diagram quite close to the screen, so that you can later on make a note of the structures which you are seeing here. Now let me explain you that what you are seeing here. The red is meaning red oxygenated blood. So this is the chamber which is the left ventricle. This chamber is left ventricle. This is containing the red blood, and this small area, this is the left atrium containing pure blood. These two small red lines, they are showing two pulmonary veins which are bringing red blood, that is oxygenated blood, from the lungs to the left atrium, from left atrium to left ventricle, and from left ventricle behind this bone into the aorta. This aorta, ascending aorta, and then descending aorta. Okay, so from the left side, this is all blue. This is deoxygenated blood. This comes from this channel, which is, we said, inferior vena cava, and this channel we said that superior vena cava. From here the blood comes here, and from here it passes into this region of the right ventricle. From right ventricle it passes through this opening. This is the pulmonary artery, and through this dividing into two right and left pulmonary arteries. So friends, this patient had typical lesion of obstruction between the left collecting chamber, that is left atrium, and left pumping chamber, that is the left ventricle. The curtains of this valve were also deformed. So normally, even if the valve is narrow, when the curtains close, the valve closes, no blood goes back into the left atrium. But with curtains deformed, the blood from the left ventricle goes back into the left atrium when the pressure in the left ventricle rises due to contraction. Then from the left ventricle we know the blood goes to the aorta, and this is again through an opening which is called aortic valve. Aortic valve is also guarded by a curtain which has got three partitions. These are three cusps of the aortic valve. They close and no blood can come back into the left ventricle. But when left ventricle contracts, these curtains open and blood flows freely into the aorta. But here in our patient, these curtains were deformed. They were not closing properly. Therefore, some blood was coming back into the left ventricle. So this will over time result in enlargement of the left ventricle. So we had a patient here who had enlarged and giant left atrium with enlarged left ventricle, with increased pressures in the pulmonary artery and with increased pressure in the pulmonary veins, in the lungs and pulmonary capillaries, pulmonary veins, and ultimately resulting in pulmonary hypertension. This leads to pressure in the right ventricle, and right ventricle becomes also somewhat enlarged, but the pressures are transmitted backwards into the right atrium, from right atrium to right superior vena cava, to right atrium to superior vena cava and inferior vena cava, and from superior vena cava they goes to the neck veins. There are no valves in these veins. So the pressures are directly transmitted to the neck veins, which become prominent, and we call it raised jugular venous pressure. So what could I do? I could not do anything for the valves. And friends, also remember it was long back, 1980, which means 42 years back. The surgery was not that advanced and everybody did not have approach to the surgery. It is an expensive procedure and everybody cannot afford it. So the only treatment which as a doctor I could do was to decongest the patient, which I started, and patient started improving. The relations started feeling happy, as well as patient started feeling happy. 3 days after start of treatment, when everything was going fine, suddenly I received a telephone from the nursing home that your patient has collapsed. I rushed to the nursing home. I, with the help of the staff, put the patient on the floor and started cardiac massage and other resuscitative measures. But nothing worked, and ultimately we had to declare the patient dead. Friends, this was a very bad situation. In the private practice, nobody wants his patient to die, because this can spoil your practice. People draw their own inferences, but whatever is the justification. But I was very careful while dealing with this patient. I was making note of everything which I was doing and which I was explaining to the relations also. So after having done all these things, I apologize to the relations that I could not save your patient, but they also appear to understand, but it could result in lot of problems. This is what you should know, that the emotional attachment of the patient's relations can result in physical harm to the doctor as well as professional harm to the doctor. A simple letter sent to the medical council can create problems for the doctor, but though in my case they did not apply, because I was very clear in my dealing, but problems can be created, unnecessary problems can be created, and I wanted to avoid those. Well, I did try to find out what had happened. Friends, these patients with enlarged left atrium, joint left atrium, cause pooling of blood there, and pooled blood has a tendency to clot. a thrombus is formed in the left atrium, which if gets detached from that place can straightway go to the brain and lodge there or cause sudden death. This risk further increases when the patient has atrial fibrillation. The only way to lessen this risk is making the blood thin by giving anticoagulants. But since our patient had enlarged liver, tender liver, and liver functions were disturbed, that was contraindicated. In addition, patient had enlarged spleen also, patient had swelling over the feet and engorged neck veins. I am deliberately avoiding the technical names for the because describing the murmur will not serve the purpose of the audience at large. So then when I was talking to these patients, they asked me one thing which alarmed me. They said that, doctor, do not write the cause of death as heart disease. So I asked them why, and they told me that the boy had an insurance of 10,000 rupees. The girl is not working, she has 2 children, and she will get this 10,000 rupees, which will be some monetary help to the poor lady. But then I was a doctor, besides I was a human being also, but I could not do such type of things. So I told them that I am sorry, but I cannot do this thing. Later on I came to know that they knew about the illness of the patient, they knew about the prognosis of the patient. With the help of an insurance agent, they got him insured for 10,000 rupees according to their means, and later on the insurance company also showed human concern and paid the lady the sum assured. So friends, these are the difficulties which we face from time to time, and we must be very careful when we examine the patient. We should write a full page, not a line that the conditions same are improved and continue the same treatment. That is not sufficient. We must mention the vital signs, we must mention chest, heart, abdomen and CNS. Are they normal or they are not normal? So if you see twice daily, write in your notes twice these type of things, which will save you at later stages. So friends, I will make here a request that like, comment on the video. Some friends do not understand. I do send them the links also. They are supposed to click the link which directly takes you people to my video. There you like, comment, and if you have not subscribed, you subscribe the video. If you want to get further information regarding more videos, please click the bell button. Thank you very much. Next time we will meet with another interesting case. Thank you very much.